So for the first article, I agree with the authors regarding the healthcare advantages they describe and how having those advantages can mean life or death for some people. I know that a lot of people do not have the financial security, medical literacy, or resourcefulness to do their own research, which can make healthcare situations very confusing and possibly affect the treatment in a negative way. I think that low income individuals in rural areas suffer the most in terms of not having the money or resources as opposed to the middle and upper class. In my opinion, there should be a bigger focus on making sure everyone is knowledgeable, at least on the basics of healthcare. In terms of inequality of care, the authors describe a situation where two different diabetes clinics were treating their patients differently based on financial status. One clinic, which saw mostly middle class patients, was providing more effective treatment as opposed to the other clinic that had lower income patients. Additionally, the authors also point out that the major teaching hospitals produce higher levels of care as opposed to other hospitals. These inequalities should not exist, in my opinion, and everyone should have the same level of care and education provided to them. For personal experience, I worked in the dental field as an office manager and insurance coordinator for about 3 years, and I saw a lot of the same issues as far as not having the proper education regarding care and not understanding how insurance works. I was great at processing insurance claims and understood how coverage worked, but I always found it concerning that most people had no idea what their policies covered or how they worked. Because of this, I always made sure to be thorough when explaining everything to them so that they were not confused and would know what to expect in the future. So for the second article, I know our healthcare system desperately needs change, and the learning health system described in the article seems very promising as a solution. I'm impressed with the way that the system continuously gathers and learns from data and directs those findings straight to providers and patients for care in a timely fashion. It seems like a no-brainer that these systems should be universal so that everyone can get the best care possible. Had these systems been in use when the pandemic hit, the healthcare system could have been more prepared and things would not have been maybe as chaotic and deadly. In the article, Vincent talks about achieving utopia and doing so by using imagination and experimentation. Doing this in groups where there's a shared interest or goal is described by the author as collaborative learning health systems. In these groups, as more knowledge is attained on a certain topic, it is communicated and shared to fellow patients, providers, researchers, and community organizations. Some benefits of this system include a more streamlined approach that reduces leaving patient care up to chance, stakeholder alignment, and allowing communities to have control over their data. Personally, I would like to be able to track my own health data through a learning health system. Being able to know when new information comes out in regard to the health issues I have would be beneficial because it seems like once you are treated, there really isn't much revisiting unless you have issues with the treatment. There could be something better that we otherwise wouldn't necessarily be informed about through the normal system. For example, I've been taking a certain medication since 2012, and I don't have issues with it, but I would like to know if there was something better, but it's never, I could bring it up, but it's not going to be brought up to me otherwise, probably. Thank you.